Welcome to our special Women's Health edition of DBL. And today's show is a wake-up call for all women to take charge of their own health. Doctors and experts will be joining us to talk about everything from hormones to cancer to sex. And our very own Dr. Payal Kohli is going to be joining us for the entire show. Dr. Kohli, thank you so much for being a part of this episode. We appreciate you.
You guys, I'm so excited to be here because we as women and men, women are taking care of other people. Yeah. And today is a day to talk about us, to talk about our health, to talk about how we can do better so we can be there for others.
Well said. And Jeff and the men at home, stay with us. I promise you're going to learn a lot today for yourselves as well.
Just going to be a listener today, okay? But I had the first question, but let's start with you. See, I already screwed up. Leave it to the man to screw up, huh?
Let's start with one of the biggest advancements in women's health. We've talked about this constantly, right, over the past year, from weight loss drugs like Ozempic, Mounjaro, Wegovy, the list goes on. Are there better weight loss drugs, Dr. Kohli, coming to the market, whether it be in pill form, whether it be less expensive?
You know, we have so much cooking on the horizon. It's really been a new era in weight loss, and physicians and patients alike have really sort of risen to the challenge of doing better. So we have many more drugs in the pipeline. They're going to be coming. Hopefully, they're going to get cheaper, because at the current price point, it's really prohibitive. And if you think about America, 42% of us are obese and could benefit from these medications. They cost $5 to make, and they're being marketed for $900 to $1,400.
That should be criminal.
That's gouging. That's called price gouging.
It's price gouging.
That is
and
exactly
it's taking advantage of the fact that this is something that is such an epidemic. It's kind of like if the COVID vaccine or the COVID treatment would have been at this price, people would be running to sort of purchase it. So I'm hopeful that the cost comes down, and I'm really excited about the fact that people are paying attention to the price. We're starting to have these conversations that drugs need to be affordable, because unless they can get into your pockets, they're not going to work.
Yes.
Except for the rich people.
Absolutely. That's the pharmaceutical industry. You know, it's all about making money. But I don't want to go there. I want to talk about some of the positives and negatives of taking these drugs, because it's only been 2 years since they've been widely used. I feel like, you know, it's taken over the country. So what are some positives and negatives?
You know, I had a woman come into my office, and she started this medicine, and I asked her, how do you feel? And she said, I have hope and I have fear. And I think that sums it up perfect at how people perceive these medicines. I mean, the hope that we have with this is tremendous, you know, because obviously the weight loss, blood sugar, we're now seeing it hit for cardiovascular disease prevention, so fewer heart attacks, strokes, and heart disease deaths. We're seeing positive effects on kidney function, maybe even heart failure. So by losing the weight, we're protecting all your organs, and we're changing the whole trajectory of your life. But as you said, we have to keep an eye on the side effects, right? Because they're starting to emerge. And if we start using it in 42% of people, 4 out of 10 people, even small things like pancreatitis, inflammation of the pancreas, problems with stomach emptying, you know, problems with vomiting, problems with depression and suicidal thoughts, all of those will start to emerge, and we'll really have to be careful.
And panic attacks. My wife has, you know, been talking about this. She's just started it, and she had to stop for a little bit because her anxiety was so high.
Really?
Yeah.
And you know, and somebody who's had psychological issues, I know Jordan's been very open about her struggle with anxiety. How does it work differently than somebody who's had depression or somebody who's had alcohol addiction? These are questions that are still unanswered.
I just want to say thanks to Jordan, shout out, because I so appreciate watching someone go through that. It's not easy to be open about that.
Yeah, so. She's very open. I'm not like...
You're not outing her anyway,
She's very open about her journey with that.
Yeah, big shout out to Jordan for that. Okay, speaking about alcohol, let's switch gears here. Talk about the leading cause of death in women. We all know is heart disease. But there's this new research that women who drink more than one alcoholic drink a day, y'all, are more likely to develop heart disease. What?
Yes, 33 to 51% more likely to develop heart disease. And this totally caught us off guard, because we used to say less than a drink a day for women, less than 2 drinks a day for men. But think about us, ladies. We're smaller. We have smaller bodies, so there's less volume for that alcohol. You know, pound by pound, we actually have less water in our bodies than men do. So if you take 2 people, a man and a woman, who are exactly the same weight, have them drink exactly the same amount of alcohol, the blood concentration of alcohol will be much higher in the woman than it is in the man. So we've been keeping up with the boys, drinking as much as they do, and it's really become a problem, especially in suburban women. We're drinking a lot more than usual, but we're not realizing that that means it's really translating into heart disease for us.
Wow. So speaking of heart health, what about stress? Does that really, have you seen in your studies that people that are a lot more stressful or even paranoid, I would say, have a higher likelihood of developing some serious cardiovascular disease?
Well, you don't even have to have a stress disorder. You can just have a high baseline level of chronic stress, and it's going to lead to more diabetes, more weight gain, more problems with mental health, and more cardiovascular disease, more heart attacks and strokes. And in fact, us as women having the same amount of stress as men actually confers us a higher risk. So we're more sensitive to stress. And there's a condition, it's called stress-induced cardiomyopathy or broken heart syndrome.
Sure.
When women are subjected to a big psychological stress, our heart can get paralyzed and stop working. And this condition, 90% of cases happen in women. So there's something about our hearts that make them more sensitive to stress.
We're so empathetic.
We're so good and
We're
beautiful
unbelievable.
creatures.
It's really very true.
It is
no
true.
offense,
It
Jeff,
is.
but
Yeah, it's true. So that's why we got to pay even more attention
Yeah. Right.
to our hearts.
That's
'cause we
right.
have such big hearts.
Wake up
ladies.
call. We huge hearts.
And every single day, we need to have a little me time. I cannot emphasize
Thank
that
you.
enough.
I agree.
I mean, we've got Sam, who's a mom. We've
Yep.
got people looking out for, family members. You were dealing with your mom,
Yeah.
Tori. So, but I feel like the end of every day, 10 minutes of me time, it'll do wonders for
Love
really
it.
changing that stress cycle.
Love it. And Dr. Coley's going to be with us all hour. Thank you for sharing all this very vital information. You're actually, like I said, going to stick around for the whole show, and we appreciate it. Coming up on this special Women's Health edition of DBL, we're going to talk about menopause and hormone testing. I have so many questions. Plus, we're going to be discussing sex after 50 and how to enhance intimacy as you age, Jeff.
I'm looking forward to it.